Good evening, good morning everyone. My name is Arlene Tricia Barboza from BSA 3, and for today's topic, we discuss the three common skin infections with their causes, symptoms, treatment, and prevention. But for now, I will discuss the diseases of the skin that you can find it on your module. So, first, what is MRSA? Infection. So, MRSA or the methicillin resistant Staphylococcus aureus is an infection caused by Staphylococcus or the staph bacteria, and this type of bacteria is resistant to many different antibiotics. So you can find it MRSA on different antibiotics, and this bacteria is naturally live in the nose and on the skin and generally don't cause any harm. So, however, when they begin to multiply uncontrollably, a MRSA infection can occur. So, the MRSA infection is typically occur when there's a cut or break in your skin. So, you can find a MRSA when you have a cut or break in your skin. So it is very contagious and can be spread through direct contact with a person who has this infection. So it can also be contracted by coming into contact with an object or the surface that's been touched by a person with MRSA. So though MRSA infection can be serious, it may be treated effectively with a certain antibiotics. So what are the different type of MRSA? So MRSA infections are classified as either hospital acquired or community acquired. So the hospital acquired MRSA is associated with infection that are contracted in medical facilities, so such as hospital or nursing homes. You can get this type of MRSA infection through direct contact with an infected wound or contaminated hands. So you need to wash your hands to get a proper hygiene and to prevent this kind of infection. So you can also get the infection through contact with contaminated linens or poorly sanitized surgical instrument. So hospital MRSA can cause severe problems such as blood infections and pneumonia. When we say community acquired MRSA, it is associated with infection transmitted through close personal contact with a person who has the infection or through direct contact with an infected wound. So this type of MRSA, which is a community acquired, can also develop because of poor hygiene, such as infrequent or improper hand washing. So what are the symptoms of MRSA? So MRSA symptoms can vary depending on the type of infections. So in hospital acquired, it is generally more likely to cause serious complications such as pneumonia, UTI or the urinary tract infections, and the blood infection sepsis. So it is important to see your doctor right away if you notice any of the following symptoms. If you have rashes, headaches, muscle aches, chills, fever, fatigue, cough, shortness of breath, and chest pain. So what are the symptoms of community-acquired MRSA? So usually, it causes skin infections. So areas that have increased body hair such as the armpits or back of the neck are more likely to be infected. So areas that have been cut, scratched, or rubbed are also vulnerable to infection because your biggest barrier to germs or your skin has been damaged. So the infection usually causes a swollen, painful to form on the skin. So the bump may resemble a spider bite or pimple. So it often has a yellow or white center and central head. So sometimes an infected area is surrounded by an area of redness and warmth. So this is known as the cellulitis. So pus and other fluids may drain from the affected area, and some people also experience fever. So Molluscum contagiosum. So what is Molluscum contagiosum? It is a skin infection caused by the virus Molluscum contagiosum. It produces begin rays into bumps or lesions in the upper layer of your skin. As you can see on the diagram, there are small bumps are usually painless. So they disappear on their own, rarely leave scars, and when they are untreated. So the length of a time of the virus lasts varies for each person, but the bumps can remain from 2 to 4 years. So Molluscum contagiosum is spread by direct contact with someone who has it, or by touching an object contaminated with the virus, such as a towel or piece of clothing. So you need a proper hygiene to avoid this kind of viruses on your skin. So the medication and surgical treatments are available, but treatment isn't necessary in most cases. So the virus can be more difficult to treat if you have a weakened immune system. So what are the symptoms of Molluscum contagiosum? If you or your child comes into contact with this kind of virus, you may not see symptoms of infection for up to 6 months. So the average incubation period is between 2 and 7 weeks. 2 to 7 weeks. So you may notice that the difference appearance of a small group of painless lesions if these bumps can appear alone or in a patch of as many as 20. So they are usually very small, shiny, and smooth in appearance. Next, it is flesh-colored, white or pink. Also, they are firm and shaped like a dome with a dent or dimple in the middle. And they're usually filled with the central core or waxy material, and it between 2 to 5 millimeters in diameter, or between the size of the head of a pin and the size of an eraser on the top of your pencils. They are usually present anywhere except on the palms of your hands or the soles of your feet. So specifically on the face, abdomen, torso, arms, and legs of children, or the inner thigh, genitals, and abdomens of adults. So you can find this kind of Molluscum contagiosum. So these are the symptoms. And however, if you have a weakened immune system, you may have symptoms that are more significant. So lesions may be as large as 15 millimeters in diameter. So which is about the size of a dime. So the bumps appear more often on the face and are typically resistant to treatment. That was a Molluscum contagiosum. So what are the causes of this kind of virus? So you can get this kind of virus, the Molluscum contagiosum, by touching the lesions on the skin of a person who has these infections. And children can transmit the virus during their normal playing with other children. So teens and adults are more likely to contract it through sexual contact. So you can also become infected during the contact sports that involve touching bare skin, such as wrestling or football. So the virus can survive on surfaces that have been touched by the skin of a person with Molluscum contagiosum. So it's possible to be contracted the virus by handling towels, clothing, toys, or other items that have been contaminated. So sharing sports equipment that someone's bare skin has touched can also cause the transfer of this virus. So the virus can remain on the equipment to be transmitted to another person. So this includes items such as baseball gloves, wrestling mats, and football helmets. So if you have Molluscum contagiosum, you might spread the infection throughout your body, and you can transfer the virus from one part of your body to another by touching, scratching, or shaving a bump and then touching another part of your body. So that is Molluscum contagiosum. Next is the impetigo. So what is impetigo? Impetigo is a common and contagious skin infection. So bacteria like Staphylococcus aureus or the Streptococcus pyogenes are the infect the outer layers of the skin. So you call this the epidermis. The face, arms, and legs are most often affected. So anyone can get impetigo, but it most commonly affects children, especially those 2 to 5 years old. So these infections often begins in minor cuts, insect bites, or a rash such as eczema. So any place where the skin is broken, but it can also occur on a healthy skin. So the impetigo, it can occur also in a healthy skin, not only on the minor cut, insect bites, or the rash or the eczema. So it's called primary impetigo when it infects healthy skins, and secondary impetigo when it occurs in broken skin. So it isn't always easy or necessary to make this distinction. So impetigo is an old disease. So the name dates back to the 14th century in England and comes from the Latin word impetire, meaning is to attack. So attack seems a fitting description for this easily spread infection. So bacteria thrive in a hot, moist conditions. So impetigo tends to be seasonal. It peaking in the summer and fall in northern climates. So in warm and humid climates, it tends to occur year-round. So an estimated 162 million children worldwide have impetigo at any one time. Impetigo is more common in developing countries and in poor areas of industrial countries. So the highest number of cases are in areas like Oceania, which includes Australia, New Zealand, and several other countries. So what is causes of impetigo? So impetigo is an infection caused by strains of staph or strep bacteria. So this bacteria can get any into your body through a break into the skin from a cut, scratch, and insect bite or rash. So then they can invade and colonize. So the condition can be contagious, and you can catch this bacteria if you touch the sores of a person with impetigo or touch items like towels, clothes, or sheets that the person used. So, however, these bacteria are also common in our environment, and it is most people who come in contact with them won't necessarily develop impetigo. So some people normally carry staph bacteria on the inside their nose, and they may get infected if the bacteria spreads to their skins. So adults and children are at a higher risk for impetigo if they have lived in a warm, humid climate, have diabetes, they are undergoing dialysis, and have a compromised immune system such as from HIV, and have skin conditions such as eczema, dermatitis, or psoriasis, and they have sunburn or other burns. They have HE infections such as lice, scabies, herpes simplex, or chickenpox, and they have insect bite or poison ivy, and they play contact sports. So when they have a risk like this, they are high risk for impetigo. So symptoms, the first signs of impetigo are reddish sores on the skin and often clustered around the nose and lips. So these sores quickly grow into blisters, O's, and bursts, and then they form yellow crust. The cluster of blisters may expand, cover more on their skin. So sometimes the red spot just develop a yellowish crust and without any blister being seen. So the sores can be itchy and occasionally painful. So after the crust fades, they form red marks that fade without leaving scars. So infants sometimes have a less common type of impetigo. So with larger blisters around the diaper area or in their skin folds, the fluid-filled blisters sunburst. So, leavingly, a scaly rim called a collarine impetigo can be uncomfortable. So, occasionally, it may involve swollen glands in the area of the outbreak or a fever. So, what are the treatment of impetigo? So, the treatment of impetigo, we have here the antibiotics are effective against impetigo, which is type of antibiotic you can get depends on how widespread or severe the blisters are. So, if you have impetigo in only a small area of your skin, topical antibiotics are the preferred treatment. So, options include mupirocin cream or ointment, or the Bactroban or Cetany, and ributramolin ointment or the Altabox. So, if your impetigo is severe or widespread, your doctor can prescribe oral antibiotics such as amoxicillin or the clovalonate augmentin, certain cephalosporins, or the clindamycin or the cleocin. So, these drugs may work more quickly than typical antibiotics, but they aren't necessarily better at clearing the infection. So, the oral antibiotics can also cause more side effects than the typical antibiotics such as nausea. So, with this kind of treatment, impetigo usually heals in 7 to 10 days. So, if you have an underlying infections or skin diseases, the infection may take longer to heal. So, the stages of impetigo by type. So, we have here the stages of impetigo by type. There are 3 types of impetigo based on the bacteria that cause them and the source they form. So, each type goes through a series of stages. First is the non-bolus. So, non-bolus impetigo is mainly caused by Staphylococcus aureus. So, it's the most common form of impetigo, causing an estimated 70% of their cases. So, it goes through the following stages. First stages is it usually starts with reddish, itchy sores, and it is around the mouth and nose. Second, it is the sores break open. It is leaving red and irritated skins around them. The third one is a brownish yellow causes form. And the last one, when the crust heals, there are reddish spots that are fade and don't leave scars. That was a non-bolus impetigo. Next type is the bolus impetigo. It is almost always caused by Staphylococcus aureus bacteria. First, it is usually form larger blisters or bullae filled with the clear fluid that may become darker and cloudy. So, the blisters start on unbroken skin and aren't surrounded by reddish areas. So, the blisters become limp and clear. So, and then, the burrs are open. Next, it is a yellowish, crusty sore forms and over the area where the blisters broke open. In the last one, the blisters usually leave no scars behind when they are healing. So, the last type of impetigo, the ecthyma. So, this more serious infection is less common. So, it is occasionally happens when impetigo is not treated. So, ecthyma goes deeper into the skin than the other forms of impetigo. So, and it is more severe than the other type of impetigo. The infection forms painful blisters on the skin of the buttocks, thighs, legs, ankles, and feet. And this is the blisters turn into pus-filled sores with a thicker crust, and it is often to the skin around the sores turns into red. So, ecthyma sores heal slowly and may leave scars after they heal. So, what is the fifth disease? So, next disease is the fifth disease. So, fifth disease is a viral diseases that often results into a red rash on the arms, legs, and cheeks. So, for this reason, it is also known as slap cheek diseases. So, it is fairly common and mild in most children. So, it can be more severe for pregnant women or anyone with a compromised immune system. So most doctors advise people with fifth disease to wait out for the symptoms because there's currently no medications and that's all shorten the course of diseases. However, if you have a weakened immune system, your doctor may need to closely monitor you until the system is disappear. So, you read to find out why fifth disease develops, who is most at risk, and how to know when that red rashes may be a sign of something more serious. So, what is causes of fifth diseases? So, parvovirus or the B19 cause the fifth diseases. So, this airborne, it tends to spread through saliva and respiratory secretions among children who are in elementary school. So, it is most common in late winter, spring, and summer. So, however, it can spread at any time and among people of any age. So, wala siyang pinipili na tao, na panahon, kung kailan siya i-spread sa tao. So, many adults have antibodies that prevent them from developing fifth diseases because of previous exposure during their childhood. So, when contracting fifth disease in adult, the symptoms can be severe. So, if you can get fifth disease while pregnant, there are serious risks for your unborn baby. So, it is including the life-threatening anemia. So, as you can see in the diagram, we have here the kind of fifth disease that, what do you call this? Affect the body of a baby or the infant. So, for children with healthy immune system, fifth disease is a common. So, it is a mild illness that rarely present lasting consequence. So, what are the symptoms of fifth disease? So, the initial symptoms of fifth disease are very general and they may resemble mild symptoms of the flu, and symptoms often include headache, fatigue, low-grade fever, sore throat, nausea, runny nose, and stuffy nose. So, according to the Arthritis Foundation, symptoms tend to appear 4 to 14 days after the exposure to the virus. So, after a few days of having these symptoms, most young people develop a red rash that first appears on the cheeks. So, it can appear these viruses first in your cheeks. Sometimes the rash is the first sign of the illnesses that notice. So the rash tends to clear up and on one area of the body and then reappear or another part of the body within a few days. So in addition to the cheeks, the rash will often appear on the arms, legs, and trunk of your body. So the rash may last for weeks, but by the time you see it, you're unusually no longer contagious. So children are more likely to get a rash than the adults. So in fact, the mainly symptoms usually they experience is just joint pain. So joint pain can last for several weeks. So it is usually mostly noticeable in the wrists, ankles, and knees. Next is the ringworm. So ringworm, it is also known as the dermatophytophis. So, dermatophyte infection or tinea, it is a fungal infection on the skin. So, it is a common diseases on our skin, and it is a misnomer. Misnomer since a fungus, not a worm, causes the infections. So, the lesion caused by this infection resembles a worm in the shape of a ring. So, hence the name. So, dun po nakuha yung ringworm. So, ringworm is usually specifically used to describe the Tinea corporis, or the ringworm of our body. So although it can sometimes used to describe Tinea infections in other locations such as Tinea cruris, or the ringworm of the grain, and ringworm infections can affect both humans and animals. So, the infections initially appears as red patches on other affected areas of our skin. And later, it may spread to other parts of the body. So, it may affect the scalp, feet, nails, groin, beard, or other areas. So, you can recognize ringworm symptoms. It varies depending on where you are infected. So within a skin infection, you may experience the following: the red, itchy, or scaly patches, or raised areas of skin called piaks. So patches that develop blisters or pustulates. Next, if you are experiencing the following ringworm, you have also patches that may be redder on the outside edges or resemble a ring, patches with the edges that are defined and raised. So if you are experiencing dermatophytosis in your nails, they may become thicker or discolored, or they begin to crack. So this is called dermatophytic onychomycosis or tinea unguum. So if your scalp is affected, the hair around it may be break to fall and bead patches may develop. So the medical term for this Tinea capitis. So find out more about scalp ringworm and its effect. So we have here the diagram of ringworm in where it is in hand, arm of the patient, and it is what causes the ringworm. So we have here the 3 different types of fungi can cause ringworm. First is the Trichophyton, Microsporum, and the Epidermophyton. So it's possible that this fungi may live for an extended period as spores on soil. Humans and animals can contract ringworm after direct contact with the soil. So the infection can also spread through contact with the infected animals or humans. So the infection is commonly spread among children and by sharing items harboring to the fungus. So if you have a patient or what do you call that? Or together with someone in your house that have a ringworm, you need to have some proper hygiene, and when he has a belonging that you use, please avoid this because you can get contact with that ringworm. So it's possible that this fungi may live for an extended period as spores in soil. So humans and animals can contract ringworm after direct contact with the soil. So the infection can also spread through contact with infected animals or humans. So the infection is commonly spread among children and by sharing items harboring in the fungus. So there are different types of fungi causes the ringworms. So doctors call ringworm different names depending on where it affects the body. So when you have a ringworm on the scalp or the Tinea capitis, it often starts as isolated scalp that develop into itchy, scaly, bald patches. So it is most common among children. Next, if you have a ringworm of your body or the Tinea corporis, it is often appears as patches with the characteristic round ring shape. So that is the ringworm of the body. Next is the jack itch or the Tinea cruris. It refers to ringworm infections of the skin and it is around the groin, inner thighs, and buttocks. So it is most common in men and adolescent boys. The jack itch. So athlete's foot, or the tinea pedis. It is the most common name for ringworm infection of the foot, and it is frequently seen in people who go barefoot in public places where the infections can spread, such as locker rooms, showers, and swimming pools. So that is a ringworm. So hand, foot, and mouth diseases, or the HFMD. So HFMD is a highly contagious infection. It is caused by viruses from the enterovirus genus. So most commonly, the coccidiovirus, and these viruses can spread from person to person through direct contact with unwashed hands or surfaces contaminated with feces. So it can also be transmitted through contact with a person infected with saliva, stool, or respiratory secretion. So HFND is characterized by blisters or sores in the mouth and a rash of the hands and feet. So if you have this infection, it can affect the people of all ages, but it is usually in children under age 5. So it is most common or familiar if you have going to a pediatrician, and their chart is also they are chart on their wall that HFMD, because it is harmful on the child, and those are severe. So what are the symptoms of hand, foot, and mouth disease, or the HFMD? The symptoms begin to develop 3 to 6 days after the initial infection. This period is known as the incubation period. When symptoms do appear to your child, you may experience fever, poor appetite, sore throat, headache, irritability, feeling unwell or malaise, painful red blisters in the mouth, drooling, and red rash on the hands and the soles of their feet. So a fever and sore throat are usually the first symptoms of HFMD. So the characteristic blisters and rashes show up later, usually 1 to 2 days after the fever begins. So what causes HFMD, or hand, foot, and mouth disease? It is caused by strain coccidiovirus, mostly common coccidiovirus A16, and it is a part of a group of virus called enterovirus. So in some cases, or other types of enterovirus can cause HFMD. So viruses can be easily spread from person to person. To your child, you may get HFMD through contacted with the persons infected, through their saliva, fluid from blisters, feces, respiratory droplets sprayed into the air, coughing, or sneezing. So HFMD can also be transmitted direct contact with unwashed hands or surfaces containing trace of the virus. So HFMD. So next, we have here the chickenpox, or the bulutong tubig. So what is chickenpox? Chickenpox is called varicella. So it is characterized by itchy red blisters that appear all over the body. So a virus causes the condition. It is often affect children, and what's so common, it was considered childhood rite of passage. So sabi nga nila, hindi ka makakadaan sa, hindi matatapos yung childhood mo kung hindi ka nakadaan sa chickenpox. So it is very rare to have the chickenpox infection more than once. So, and since the chickenpox vaccine was introduced in middle 1990s, the cases have declined. And as you can see in the diagram, we have here the diagram of a chickenpox in the area of the back of the human. So symptoms, it is an itchy rash. It is the most common symptoms of chickenpox, and the infection will have to be in your body for around 7 to 21 days before the rash and other symptoms develop. So you start to be contagious to those around you up to 48 hours before the skin rash starts to occur. So the non-rash symptoms may last a few days and include fever, headache, loss of appetite. So 1 or 2 days after you experience these symptoms, the classic rash will begin to develop. So the rash goes through 3 phases before you recover. So this includes you develop the red or pink bumps all over your body. Next, you bumps become blisters filled with fluid that leaks. And the last bumps become crusty, scab over, and begin to heal. So the bumps on your body will not be able in the face at the same time. So the new bump will continuously appear throughout your infections, and the rash may be very itchy, especially before it scabs over with the crust. So you are still contagious until the blisters all over your body have scab over. So the crust scab areas eventually fall off. So it takes 7 to 14 days to disappear completely, the chickenpox. So what can causes chickenpox? So the varicella zoster virus, or the VZC can cause the chickenpox infection. It is most cases occur through contact with an infected person. So the virus is contagious to those around you for 1 to 2 days before your blisters appear. So the VZV remains contagious until all blisters have crusted over. So the virus can spread through saliva, coughing, sneezing, and contact with fluid from the blisters. Next is the systematic lupus erythematosus, or the SLE. So the immune system normally fights off dangerous infections and bacteria to keep our body healthy. So an autoimmune disease occurs with the immune system attacks in the body because it confuses it for something foreign. So there are many diseases occurs in when the immunity system attacks the body because the autoimmune diseases including the SLE. So the term lupus has been used to identify a number of immune diseases that has a similar clinical presentation and laboratory features. But SLE is the most common type of lupus because people are offering to SLE when they say lupus. So SLE is a chronic disease that have phases of worsening their symptoms that alternate with periods of mild symptoms. So most people with SLE are able to live normal with treatment. So according to the Lupus Foundation of America, at least 1.5 million Americans are living with diagnosed lupus. So the foundation believes that the number of people who actually have the condition is much higher than the many cases undiagnosed. So the recognizing potential symptoms of SLE. So symptoms can vary, can change over time, includes severe fatigue, joint pain, joint swelling, headaches, rash on the cheeks and nose, which is called the butterfly rash, hair loss, anemia, blood clotting problems, and fingers turning white or blue and tingling when cold, which is known as a Raymond's phenomenon. So other symptoms depend on the part of the body but the diseases is attacking, such as the digestive tract, the heart, or the skin. So lupus symptoms are also symptoms of many other diseases, which makes diagnosis tricky. So if you have any of these symptoms, see your doctor, and your doctor can run tests to gather the information needed to accurate diagnosis. So what is the causes of SLE? The exact causes of SLE isn't known, but several factors have been associated with the disease. First is the genetics. The diseases isn't linked to a certain gene, but people with lupus oftenly have family members with other autoimmune condition. Next is the environment. So the environment triggers can include ultraviolet rays, certain medication, viruses, physical or emotional stress, and trauma. So next is the sex and hormones. SLE affects women and more than men. Women also may experience more severe symptoms during their pregnancy and with their menstrual periods. So both of these observations have led medical professionals to believe that the female hormone estrogen may play a role causing SLE. So however, more research is still needed to prove that this is a theory. Next is the shingles. Shingles is an infection caused by the varicella virus, which is the same virus that causes chickenpox. So even after the chickenpox is over, the virus may live in your nervous system for years before reactivating shingles. So shingles may also refer to the herpes zoster. So this type of viral infections is characterized by a red skin rash that can cause pain and burning. So shinglings usually appears as a stripe of blisters one side of your body and typically on the torso, neck, or face. So most cases of shingles clear up within 2 to 3 weeks. So shingles are rarely common and more than once in same person, but approximately 1 in 3 people in United States trusted source will have shingles at the same time on their life, according to Centers for Diseases. So the symptoms of shingles. First, symptoms of shingles are usually pain and burning. So the pain is usually on one side of the body and occur on small patches. So a red rash typically follows red patches, fluid blisters, and then break easily, wraps around the spine to the torso, on the face and ears itching. So some people experiencing symptoms beyond their pain and rash with shingles. It may include the fever, chills, headache, fatigue, muscle weaknesses. So rare and serious complications of shingles include pain or rash that involves the eye, which should be treated immediately in order to avoid permanent eye damage. So loss of hearing or intense pain in one ear, dizziness or loss of taste on your tongue, which can be symptoms of Ramsay-Hunt syndrome and also requires immediate treatment. Next is the scarlet fever. So scarlet fever is known as scarlatina. It is an infection that can develop people in one strep throat. So it is characterized by a bright red rash on the body and usually accompanied by a high fever and sore throat. So the same bacteria that causes strep that also cause scarlet fever. So as you can see, we have here the diagram of strep throat rash. So a rash is the most common sign of fever in both adults and men. So it usually begins as a red blotchy rash and becomes fine in sandpaper. So the scarlet colored rash is that gives scarlet fever its name. So the rash begin up to 2 to 3 days before a person feels up or 7 days after.